different way. The big thing that I think is worthwhile for people with cystic fibrosis paying attention to with pranayama is, hey, it's a skill, learn. The other potential entry barrier to pranayama is it is not considered something that a rookie who's never practiced yoga should dive right into. In fact, research shows that the single most likely injury people are going to have from yoga is from pranayama. It's pleural pain, which that's the simple version of that is it'll make it feel like it hurts to breathe. It doesn't happen to everyone, happens to a small amount of people, but if you're wanting to injure yourself in yoga, dive into pranayama with no help. The second term, the one that I think is worthwhile for us, is just kinesthetic awareness. Kinesthetic meaning the ability to move and control your movements. And kinesthetic awareness is a person's individual ability to notice and control micro movements, or very, very small movements within your body. The way this looks in yoga instruction is you'll be told to hold a specific pose, and you'll be told to breathe into that part of the body. This is the part that's a little bit easier to extract from yoga and turn into something that we can teach people. It's incredible. It's been shown to be beneficial for people with respiratory conditions. So any research that says yoga helps people with respiratory conditions, this is what they mean. They don't mean that, hey, stand on your head, it'll help everything. They mean, hey, we not only will you strengthen certain parts of your body, but there will be this focus on how to breathe in a specific way. This is where the benefits come from. This is where the benefits come from for anyone in the world, but we're obviously not talking about everyone in the world right here. This is where I think the money maker would be for people with cystic fibrosis. And it's, the big thing is it's skills that can be practiced outside of yoga. So you don't have to, if you become more kinesthetically intelligent, it's not like you only experience that when you're on your mat. That becomes part of your day-to-day living. So you already talked about the idea that you'll be told to breathe into a specific part of your body. And really just by practicing this, you'll get better. The good news about it is, like I said, research shows you'll get better, but this actually creates its own entry barrier. It's an imprecise way to learn how to control your breathing, in that not only is it kind of at the mercy of what type of yoga you're doing and what poses you're holding, but the average person who teaches yoga, they don't have cystic fibrosis. So they're likely not going to be tailoring this to people with cystic fibrosis. Additionally, I think cystic fibrosis is important because it affects me. Most people don't have cystic fibrosis, so it doesn't even cross their mind. So not only are the teachers not teaching it that way, but the average student, it's a non-issue for them. In terms of yoga, if this is your entry point, there's actually a decent amount of self-directed learning that has to take place. And that relates to a separate problem related to any time people with cystic fibrosis are told, hey, if you do this, you'll experience life better. You'll have these better benefits. Which is that most people with cystic fibrosis aren't looking to find out that they have this other problem at face. Most people with cystic fibrosis are not looking for another way to have to lob 6 hours out the window each week. Time scarcity, if you live with people with cystic fibrosis, that is a real issue. And even more important, let's say time scarcity was not an issue. The research surrounding, the research that I came across, and maybe Dr. McCarthy's experience is different. Research I came across said the average person with CF actually doesn't adhere to their treatment regimen that well. The spectrum that I found was the average person complies with between 30 to 70% of what their doctor has said needs to be their required treatment practice. Meaning, for this to be helpful, it needs to be something that doesn't take that much time, because if you don't have the time to take an ADEC when you are already eating anyway, you're not going to find another 6 hours. Fortunately, there's another school that has decided breathing instruction is essential. And if you're a person who likes the idea of yoga, something that's very, very old and practiced for a long time, if you like that idea that, hey, this isn't something new that people invented, people have been benefiting from this for years, there's something that even predates yoga as a form of teaching breathing and helping people just breathe better. Singing. The research I came across, now it wasn't CS specific, it was respiratory condition specific, says that if we create a Venn diagram of the benefits of yoga, and the respiratory benefits of doing yoga, and the respiratory benefits of singing, it's a circle. They're the exact same type of benefits, which means there's likely just a huge amount of overlap in what the skills are. But singing and voice instruction as a whole, forever, has a completely different way of teaching people how to breathe. And first, what it does is it breaks breathing down into two general types. It's actually three, but for all our purposes, we can say two. And the first is, it's called clavicular breathing. Your clavicles are your collarbones. Clavicular breathing, if that term means nothing to you right now, it's shallow breathing. It is the type of breathing that people with respiratory conditions are more likely to autopilot towards, just because if breathing's hard, I mean, this isn't rocket science, people don't like to do stuff that's hard. And if breathing itself is hard every time, you're not going to sit. The average person who hasn't been taught how to breathe is not going to sit and try every moment to breathe well. So, clavicular breathing, type of breathing, that's what lots of people do. Singing would say that is the suboptimal way. But we have a quick test to see how many clavicular breathers we have here. I'm going to guess it's almost everyone. If everyone's okay with this, on the count of three, I want everyone to take one deep breath. 1, 2, 3. If you just stood up, if you just raised your shoulders, you're a clavicular breather. And I'm sorry. You can learn how to avoid this. But for those people that hear breathe deep, they think, okay, target right here, everything gets better. That's actually not the way that is most beneficial to breathe. The other term that singers use, which is not exactly anatomically correct, but it's good enough, is diaphragmatic breathing. And what that focuses on is teaching people how to relax parts of their stomach so that instead of trying to breathe up here into your chest, the felt sense is as though you're breathing into your lower back. Your lungs are, of course, not in your lower back. But by having those areas relax, it lets people more effortlessly have a full breath. The goal for singers is to actually be able to kind of bridge that gap, where it's not that you're just breathing deep, you're just breathing in the top of your chest, it's you're doing both at the same time. And for the other benefit of singing instruction is it's not only it's done systematically, but if everyone here has likely seen someone sing, you've likely noticed that if they look like they're out of breath, they're not going to stop. They're going to take 5. They're not going to find their chair, sit down, take a handful of breaths. Singing teaches people to breathe instantaneously in a way that you do not even notice. Meaning the goal is autopilot teaching. The negative side of teaching breathing the way singers do is there's none. It's systematic. You don't have to practice that long. It teaches you in a way that is easily generalized to the rest of your life, and if you're cystic fibrosis, easily generalized into airway clearance. Singing's where it's at. Yoga's great, and if you're a person who's already going to do yoga, do it. But if you're like many people who, hey, yoga's a lot. Singing's the route that I recommend people going. So we've gone over these couple different schools of teaching people how to breathe. I happen to think that these schools, whichever one you happen to choose, can be used as tools for people, parents who have kids with CF right now, people who have CF right now. They can be utilized at 3 separate levels. What I differentiate as the organizational level, the therapeutic level, and at your home level. Hey, if I leave here today, what can I practically do right now to make my life better? And at the organizational level, there are, for many different types of conditions people have, there are not just expected but required forms of occupational and physical therapy. For example, if you've got a kid with autism and they have severe autism, your kid is going to suffer from motor skill deficiencies. Your kid will receive help on how to hold a pencil, grab a doorknob, tie shoes. It's considered an essential life skill. It's not just an essential life skill that says, hey, Mom, I know you have like 9,000 things at home to do, but you better do this or your kid's life's going to suffer. It's the type of thing that people have institutional support for. And I really think breathing instruction should be viewed from that way, that it's not something that the top 10% of people who should be taught. It's something that every single person should be given a regimen for. And this isn't necessarily like my idea of, hey, I've experienced this well and it can work well. There's research to back this. There's research through thousands of different journals, hundreds of different institutions that says, hey, these 2 schools actually do help people breathe. This is not a gigantic jump. This is taking something we already know and saying it's not that big a deal to add in early childhood, especially with parents who, again, if you're a parent, you're expected to know 1,000 things with CF. Why the heck would this be on your radar? This is the type of thing there could and should be institutional support for. At the therapeutic level, now this is the one area where my solution, I would expect reasonable pushback is, I think it should be breathing practice, not just airway clearance, but breathing practice itself should be considered something that every single person with cystic fibrosis is told they need to engage in specific exercises for specific amounts of time until those skills are on autopilot. Now, once those skills are on autopilot, you don't need, if you actually do your best and do your nebulizers, you don't actually need to allot any more time. You have to sit on your ass for like an hour anyway. You can just do it while you're doing your treatment anyway. Just put down Twitter for like 5 minutes. Hey, you're done. And the other part about what I call the therapeutic level is you don't have to practice breathing that long to have generalizable benefits from it. When I first learned about this, I didn't learn about this until I was into my 20s. I didn't practice this stuff for like an hour a day. I threw on my headphones, listened to a podcast, listened to music, or I threw on a movie I wanted to in my free time. And I did it for 15 minutes. And I have, in my mind, now I didn't go back and do all my research, take all my FEV1 levels from, before I started this and then compare after. But my experience is my treatments are way better. And my ability to, let's say, call the clinic and if I'm feeling ill and give them very, very specific symptoms of what I'm experiencing is incomparable. And now that's, if you experience having CF, that is an obvious benefit. But let's say you're a nurse or a doctor who works with people. You've probably gotten that email or phone call from someone saying, I'm sick. Which then leads to the follow-up of, okay, what's going on? My lungs don't feel good. Okay, well, how do your lungs not feel good? All these things that are not actually helpful. Breathing practice helps make these non-issues. And what I call finding the home, hey, what can I do in my house today? In the same way that we live in the best time ever to be born with a condition like this, or not just a condition like this, for almost every single area of life you could focus on, 2016 is the best year to be born in the history of the world. That exists here too. There's a lot of online help that people can get. Spend some time on YouTube. Some good news and bad news about that, which I'll get to in a second. There are also some people who will actually contract and do this as outside help. They will be the expert who would pay for their expertise. The good news and bad news about self-education is, for anyone who's screwed around the internet for a while, you know that there's a lot of great info. There's a lot of, let's just call it not great info, that's available through the same searching mechanisms. It can actually be a fairly daunting task to watch all the videos that you necessarily need to teach oneself how to breathe, and to also mitigate the fact that, again, like a video that teaches someone how to breathe for singing, there will be no airway clearance portion. Now, singing actually does have its own airway clearance exercises, but that's not the typical form that singers teach breathing about. So like I said, there are free resources, and free resources are significantly better than believing that, hey, there's no skill to learn at all. I'm fine. You're likely not. Now, what I happen to think is something that is more beneficial, or could, if you want to learn how to do it fast, is actually teach this. It's part of that organization that I told you about earlier. Because of, issues relating to making myself or other people sick. If you have cystic fibrosis, you'd have to do this with me via Skype. I've had CF for 29 years. My goal is to make it to 30. I've taught yoga for 8 years. I've dealt with singing instruction for 4 years. And I've actually spent a decent amount of time learning how to put these two together and in a meaningful, quick way that people with cystic fibrosis can easily turn into a regimen. And if you're the type of person who would say, hey, you know what, contracting with someone for an hour versus wasting 12 of mine is, it's a benefit. There are people like me, I don't know who else does this, but there are people like me who actually have decided that they could teach this systematically. For anyone who's interested, that's my contact information. I'll leave it up there just while we conclude. Connecting back to the whole idea of mindfulness, there are a lot of what we talk about with cystic fibrosis is, hey, what's coming? Hey, what's the next pharmaceutical? And by the way, that obviously matters. I'm not saying to do this in place of pharmaceutical. But there are resources, there are things people can do to make their lives better that are not contingent upon having health insurance cover a $30,000 a month drug. There are things, there are skills people have already devoted time to mastering that are accessible to other people. It's really more a matter of whether you or your loved ones have decided these skills are worth learning. I'd like to thank everyone for their time. And just sorry for jumping the program. I'm not going to be here for the second half in case anyone asks questions. It's my wife's birthday. So if anyone asks questions, I'm more than willing to answer. But anyway, again, thank you.
I'll have Ryan kind of just stay right here if you have questions. I do want to do a couple plugs. We have some videos you might have seen. This exercise, Your Future, was developed by Seattle Children's Hospital. This is more of a pediatric focus, like exercise ideas that, again, is an adjunct or, helps certainly with area clearance. And then this was a yoga DVD for CF that was the CF Foundation has accepted and has been sending out. So we have those on the back table, and I would love to get Brian's input on this, so feel free to take one and then let us know what you think about it. And then for mindfulness, there has actually been some great studies. I saw at NACFC, the national conference last year, on mindfulness, and they have done clinical trials with mindfulness and how it affects CF. And there's some really great benefits. And right now there is a class that is being offered by an adult physician who has cystic fibrosis, and it's a mindfulness meditation class. So it's a stress, reducing stress with mindfulness. And both Oscar and I have information if you'd like to learn more about that. So any questions for Brian right now? Go ahead, Peter.
I was wondering, there's been some peer-reviewed research that shows that didgeridoos are good for something beyond singing, because that doesn't
Not
everyone do brass or woodwind instruments. Do you know anything about that?
Yeah, some of the information I came across was similar. And so the reason I highlighted singing was not just about singing itself, it's that the skills that people are taught in singing it's easy to extract those from singing and practice them completely divorced from the idea that you ever want to have anyone hear you emit a note at any frequency whatsoever. Now, yeah, in terms of woodwind instruments, in terms of things like flutes, yeah, there is research that the people who practice those, they learn how to breathe a specific way. A lot of it's similar. It's people learning how to target specific areas that they're going to breathe. Now, for playing the instruments and for singing, the exhale portion is about usually having a slower control of your exhale, which is not what you would do for airway clearance. However, the great thing about that is it's a really hard skill to learn how to control your exhale that way. It's not a hard skill to learn how to cough. Most people have that mastered by the time they're 20. So in answer to your question, yeah, there are benefits. It's just if you're going to extract that from the actual practice itself and say, hey, how's this help my life with CF? It's taking the practice of the inhale, how to access different parts, how to feel different parts, and instead of slowly exhaling, turning that into a cough. Thanks for the question.
Sure.
Yeah.
Well, this is not really a question, but I fully support what you're saying. I mean, it's fabulous. I happen to be an occupational therapist working in home health, and so your comment about OTs teaching breathing, it's really not so much of what I do, but positioning is a really critical thing. I will go in to see a patient who is totally forward flex, can't breathe, COPD, CHF,
Yeah.
and if we get them into trunk extension and upright posture, breath control, it feeds into, so the clavicular breathing reduces all that stuff. But I appreciate I'll focus a little more on the diaphragm breathing a little bit, although I'm getting ready to retire. but yes, the positioning part to me is what's really critical because it's hard to diaphragm breathe when you're totally forward flexed.
Now it is, but the pushback. This is the pushback. The information that I'd add is part of singing the instruction that I have come across for practicing how to breathe as a singer. Some of those actually involve drills where you're not standing upright, where you actually are bent over, and the goal is actually to still access the same areas. And in some ways, it's actually easier if you're bent over a little bit. Now, I mean, if you're bent over rigidly contracted areas, that's a completely different ballgame we're talking about. But if you're like a person, let's say, doesn't have the on-demand muscular control to always be in an upright position, there are drills that specifically focus on how to get 100% what you can access. Volume on your inhale while you are bent over. It's actually part of the teaching of the kinesthetic intelligence portion. But again, in terms of skills what skills can I divorce from this practice and give to someone right now? Those are other skills that you can even further take away. Where, from the singing instruction perspective, you could easily say, let's say we're talking about someone who can't stand up. Well, I won't be teaching them any sort of breathing practice that requires a person to stand up. I'd be doing anything that a person can easily do while sitting, and there are actually a lot of different drills that can be practiced that don't take that much time. They're not, it's different from something like yoga, which there is some motor skills expected in yoga. There are way less motor skills expected in the singing realm with, like I referenced, the same benefits. And thank you for the contribution. I mean, really, in my mind, any people who are willing to view this as a skill, any people who are willing to view this as an essential life skill, are the people who are on the right side of this, or the best side of this right now.
Email or phone number, you can always reach out to me and I'll certainly pass information on. So I have Dr. McCarthy. He needs no introduction. I'm going to get his PowerPoints ready, but we're thankful that he was able to come today and present to us.
Well, thank you very much, Kendra. And Brian's a hard act to follow. That was amazing. I really loved that and loved the humor and loved the wisdom. Thank you for doing it, Brian. That's great. And Rebecca's always great. Kendra's always great. So I think all these acts are hard to follow. When we talked about what I was going to do, I don't know how we came up with this exactly, but what's old and what's new is the basic of this. And we're running a little bit late, so I'm going to zip through some of it. But I don't know if I've ever spoken to this forum about the what's old part. I don't think I've done that in some grand rounds. But years ago, I put together a little section of a talk on sort of the history of cystic fibrosis. And cystic fibrosis really has a very fascinating history that I'd like to share. I just think this is really cool stuff. So, okay, Kendra, what do I do? So, I'm calling it the 410-year history of cystic fibrosis, starting as a very mysterious syndrome, and now we're on the verge of a cure. And so this is what I want to go through a couple of details. And I would emphasize the somewhat personal version because when I was sitting down to write these, can everybody hear me? I don't know if this was too grandiose words or not, but I was writing these slides the other night, and everybody in this room has a personal and an important story about cystic fibrosis, and I think not only do we all share, it's hard to even say what we all share, but I think we all have a tremendous amount of emotion about cystic fibrosis, and our stories are very important, and we really have such an impact on one another, and it really touches me to think about that. So, and when I was thinking about the 410-year history of cystic fibrosis, all the people that came before us had similar fascinating stories, many of which I know, and many of which I have no idea about, but would like to learn more. It's just really interesting. So I'm going to go through some of the sort of what I would call the stages of cystic fibrosis. Okay, the very first known written medical description of cystic fibrosis was in the Middle Ages, and I wish my new partner, most of you probably know Dr. Chavez, and a few of you don't yet, are, oh, she's here, okay. So I'm not going to say anything bad about her. But she's a wonderful addition to our group. I just love having her here. And I had no words of Spanish whatsoever, and I'd love to hear her say this guy's name because I couldn't come even close. Do you want to pass on that, or do you want to?
Alonso y de los Reyes de Fonteca.
Okay, I took French in high school, not Spanish, but I should have heard of it. Anyway, this was when cystic fibrosis, as far as we know, was first described formally, and maybe, first described informally, for that matter. A professor of medicine in Spain, and probably most of you have heard this, the kind of old saying, known as an old saying, but this is what it comes from apparently, that if there's a baby that you find he has a salty taste, that baby is bewitched and is going to die very shortly. And that was everything that was known about cystic fibrosis, and presumably there were treatments that were associated with that, having to do with bewitching and so on and so forth. So that's where the story starts, as far as I know. Not much happened in the next 300 years or so with cystic fibrosis. And then the story gets interesting again starting in the 1930s. And there were a few very influential and interesting people that were involved in describing what I would say, you could say this is the beginning of the modern era, or it depends on how you formulate it, but more than just a mysterious syndrome that has to do with being bewitched. There was a pediatrician, and I don't know so much about this guy. All medical students learn Fanconi because there's Fanconi syndrome. I wish I could remember what it was, but that's what the name is mainly famous for. But just glancing through Wikipedia the other night, a couple of facts I learned about him. He was from Switzerland and practiced in Zurich. He was a very prominent pediatrician, and he's considered one of the founders of pediatrics. That's sort of when people really started to develop, take care of children as a medical specialty. And apparently he was an extremely good observer of when you see one case of something, you say, well, that's weird. You see 2 or 3 or 4 cases, and you say, well, there's something going on here. This is a pattern. And he described all sorts of syndromes, including Fanconi syndrome, but he was the first, I guess, since the guy that Alma told us about, his name for us, who wrote about cystic fibrosis, and he authored a paper along with some co-authors describing several cases of children who have bronchiectasis, and they seem to be different. Bronchiectasis is a specific type of airway damage that occurs in CF and other conditions as well. And so this was an early, very important paper in CF. Another person in the 1930s that I learned about last time, and I wrote some slides like this, is Dorothy Anderson. And she's got an interesting story. She was an early woman pioneer in medicine. There weren't very many women who went to medical school or did medical training back in this era. And apparently she was amazing, and she was an incredible surgeon. And she was at Columbia in New York City. And one of the really interesting parts of the story is that when she finished this whole training, and everybody acknowledged that she was a wonderful surgeon, she was barely allowed to do surgery because she was a woman. And I think she did a few operations, but basically was blackballed for being a surgeon, even though she had the skills and so on. So she ended up sort of having to be, by default, having to be a pathologist. And she further made observations about the pathology of these children that Fanconi was also talking about, and particularly tied in the lung stuff with the pancreatic stuff. Still not really understood how it ties in, but so the story starts to build. Okay, so that's the 30s. Then we move forward to the 1950s, and this is what I sort of made this up, the invention of cystic fibrosis in terms of really starting to put the story together. How do the lungs and pancreas and so on and the sweat all fit together? So it's the start of it. In the 1950s, this morning when I was thinking, trying to remember what my slides said, I was getting ready to leave the house and I added a couple more, but I'm going to have to go back and count, so I'll try to remember to mention these in a minute. But so there was a gentleman, Lowe, who was able to describe, 1949, discovered the genetic pattern of cystic fibrosis, and of course, way before discovering the gene, they discovered it was an autosomal recessive pattern, which means that two carriers carry a gene and may or may not have characteristics, but they don't have the disease itself. And if those two genes come together in your child, then that patient will have cystic fibrosis. And so that was reported then. I'm going to see the next line. Then in 1953, there was a doctor, a pediatric pulmonologist, although that didn't really exist in those days, that particular specialty, but he basically was, called his Antiquities, and he was in New York City, and he was an observer of patterns as Fanconi was, and he was very intrigued by an epidemic of patients, of children in New York City in a very hot summer who got dehydrated and came in extremely ill, maybe somebody died, I don't know the whole story there. And they had a very specific kind of dehydration. Not only were they out of fluids, but they had lost too much salt. That's hypernatremic dehydration. And he then recognized that seems to be some of the same patients that are being described. And it was already known way back hundreds of years ago that there was a salty taste to the skin, but he then put two and two together in a way that was never put together before, and invented the sweat test, which became the gold standard, and sort of is still the gold standard, and of course sort of is not, because we don't actually test it. We still do sweat tests when we're having trouble figuring out the diagnosis of the patient. Now, the two that I added here, one is for obvious reasons, the other may not be quite yet. The obvious one is Watson and Crick in the discovery, not the discovery of DNA, but the discovery of how DNA works to become, basically, to be the genetic material that then passes on genes and encodes for whatever it is in the body that we're talking about. So apparently DNA was actually described in 1863. I don't know by whom, and there's a whole story, a whole bunch of names and so on. I didn't get time to read all that. But at first they didn't know what DNA was, and then at some point they figured out along the way, various researchers, that DNA was the genetic material, but they didn't know how it worked. I mean, it was just this certain kind of chemical. And how does that genetic material, how does that chemical actually work as a blueprint to make a gene product, or to make, maybe in the case of cystic fibrosis, to make the chloride chain? Well, we do nothing about chloride chains, but let's get way into the story. And so Watson was an American, Crick was British, and they worked together collaboratively, and it's a whole fascinating story which I read in high school and had no idea that I would ever get involved in anything like that. I remember reading the book, but about the DNA and how the different base pairs, it's called, are put together so that it then says, well, this is what the product is going to be, this is what the protein, this is what the chloride channels will be, this is how it will be derived, blue instead of brown, or whatever the genetic characteristic is. And one of the interesting things that I remember about actually the book that I read in high school is the story, DNA in the human being is called a double helix. So there's two strings of DNA, and they go together, and that is somehow part of the very important process of being a blueprint. And when they figured out how DNA encoded, they still didn't know anything about the chemo. And somehow they just puzzle. It was a very difficult thing to figure out. And there were other investigators trying to race them to figure it out as well. And nobody could figure it out. And I know so little about this that I don't know why it was so difficult. But it seemed to just stump people incredibly. And eventually one of them, and I don't know who it was, solved it through a dream. Woke up one morning and had this dream about two snakes that were entwined together. Woke up and said, that must be how it is, but because it wouldn't make any sense any other way. So that's some of the that's 1953. Now, in 1952, does anybody, somebody, know the name Woody Guthrie? Guthrie. So Woody Guthrie was a sort of, I guess you'd say, a folk singer, a singer and songwriter back in the Depression era, which probably nobody here remembers. And a very famous guy wrote "This Land Is Your Land" and a bunch of well-recognized, I think folk would be the right word. At any rate, at about age 40 in 1952, he started having problems. First was actually diagnosed with mental illness and alcoholism, which I don't know, maybe he also have, but at least some of his manifestations, or possibly all of them, eventually turned out not to be due to those problems, but to Huntington's chorea, which he felt, which is an inherited degenerative neurologic disease, something vaguely like ALS or Lou Gehrig's disease, and eventually died of that. That was in 1952. At that time, it was known to be genetic, but again, the gene hadn't been found, and so on and so forth. And I remember, kind of growing up in my era of the 60s, his son Arlo Guthrie, who wrote Alice's Restaurant and some others, was terrified because this is a disease that you are born with the tendency towards. You're going to have it or you're not going to have it, but you have no idea unless you know what the gene is, which they didn't know what the gene was, until you start to develop symptoms, which I guess 40 is a pretty typical onset to middle years like that. And Arlo turned out not to have it, but he didn't know. He was terrified for years. There was a lot of publicity about that. So that's sort of the story that was going on in the 50s. All right. Now,